They have done all the investigations and they said that we're both normal. These are words that we hear frequently in the fertility clinic. Now, sometimes actually all the basic investigations have been done, but most times we found out that either the couple have not had any fertility investigations, or they've had the investigations done, but they were not done correctly in terms of timing or in terms of instructions that need to be followed. So in this video, I'll be going through the basic investigations that need to be done in every fertility evaluation. Now, bear in mind that this may vary depending on different regions of the world and also depending on different clinics, but I'll just be going through the basics. So I'll be starting with investigations that should be done in the female partner or the woman. These include blood investigations for the hormonal profile. So this is usually timed based on the woman's menstrual cycle and ideally should be done between days 2 to days 4 of her menstrual period. Now this includes testing for FSH, which is follicle stimulating hormone, and luteinizing hormone. It also includes testing for hormones like the anti-Mullerian hormone. Now out of all of these, the two most important are the FSH and the AMH, which tell us about something called ovarian reserve. Ovarian reserve just means how many eggs are left in a woman's ovaries, because we know that a woman's ovaries are like a bank where there is no deposit, only withdrawals. So when a woman shows up for fertility evaluation, we want to know actually what is left. So what's the balance in effect? Other blood investigations include progesterone levels. So this is usually timed again based on her menstrual cycle, and for a woman who has a 28-day cycle, her progesterone test should be done on day 21. So this means that for someone who has a longer cycle, like a 35-day cycle, their progesterone test will be done much later, around day 28. And for people who have very irregular cycles, it can be done weekly after that until the next menstrual period. In addition to the hormonal profile, another blood test that is done is viral screening. So for HIV, hepatitis B, and hepatitis C. And this is meant to just know the infection status of the woman so as to reduce passing on an infection either to her partner or to her baby. A rubella screen is also done to make sure that any woman who presents for fertility evaluation is immune against rubella or German measles. If you want to know more about this, please watch my video on rubella vaccination. Another investigation is the transvaginal ultrasound scan or the internal scan to look at the gynecological organs of the woman. Now, ideally, this is usually done as part of her first consultation and is called a baseline scan. Now, this scan is going to look at the womb, telling us about the size, the appearance of it, making sure that there are no abnormalities like fibroids or any tumors. It's also going to be looking at the inside, so the cavity of the womb, looking for any fibroids or polyps within that. If there are any swollen fallopian tubes, then it's going to show. So for any woman that has things like what we call a hydrosalpinx, which is a swollen fallopian tube, it will show on scan. Another important thing that we check in that scan is the antral follicle count. So we count the number of follicles a woman has in both ovaries, and this also helps us to have an idea of her ovarian reserve. So I'm going to leave an insert of the normal range for these results so that you have an idea of what's normal and what's not. Another test that is carried out is a high vaginal swab to screen for chlamydia. Now, this is important because during a fertility evaluation, most women undergo a lot of invasive testing from down below, like a HSG, also when they're having their embryo transfer or egg collection. And so we want to screen for any infection so that it is treated and we don't end up pushing up an infection from the lower genital tract to the upper genital tract and potentially spreading infection. So that's the importance of having a swab test done. The other group of tests that are done on the woman are for tubal patency. So this means testing to make sure that the fallopian tubes are open. The common test used is a HSG or hysterosalpingogram, and also something called a HICOC, which is a hysterosalpingo contrast ultrasonography. Now the difference between the two is that the HSG is done using an X-ray, while the HICOC is done using an ultrasound scan, and the dye and the contrast we use in both situations are also different. And for these two tests, we use them in women that don't have any coexisting comorbidities like endometriosis, pelvic inflammatory disease, or any other pelvic abnormalities. For women who have these abnormalities, it's advisable that the kind of testing they should have should be a laparoscopy and dye testing or chromotubation, so as to give an opportunity for some of these conditions to actually be seen and potentially treated at the same sitting. Now, other investigations that might not be routinely offered to all patients, but these investigations are individualized if these patients require them. For instance, prolactin and thyroid levels. So for women who have any signs of high prolactin levels or hyperprolactinemia, like milky discharge from their nipples, something called galacturia, will be offered a prolactin test. And also women who have any signs of thyroid disease can also be offered a thyroid function test. Now for the man, the investigations we do are mainly blood investigation and semen analysis. The semen analysis is the basic investigation for every man who is presenting for fertility evaluation, and there are instructions that are given for the test, and it's very important to follow these instructions in terms of the numbers of days that it's advisable to abstain from sexual intercourse before giving the sample, and also how to collect the sample. Because in a situation where there's a spillage, the lab might wrongly assume that the test is abnormal when in effect a large quantity of it has spilled. And to know whether or not the test is normal, we use the World Health Organization reference range, which I'll put up here so that you know what is normal and what is abnormal. Now for the blood test, usually it's a viral screening, just like we've done in the woman, looking for HIV, hepatitis B, and hepatitis C. And the importance of this is to be able to detect the infection, manage it with a specialist, and also to reduce the chances of transmission both to the partner and to any baby that is formed. Now, any additional investigations like blood tests for karyotyping or genetic screening and any other advanced testing is done after review of these basic investigations. So if you're attending any fertility evaluation, it's important that these investigations, these basic investigations are done.